Hi, I'm Kerry. Some of you will know me and some of you might not, but today I kind of felt a bit inspired by somebody that is suffering with acute pain, and having had members of my family that suffer with acute pain, and at times myself suffering with pain, I thought it was actually something quite relevant. Anyone that has any kind of form of pain, whether it's sort of a temporary thing or a permanent thing, will understand how it can really change your life. And having something to use to handle the pain, manage the pain, whatever way you want to sort of speak about it, is something that everyone needs, really, whether it's something temporary or something more permanent. So I thought, okay, I can't get to everybody, they can't all get to me, and there's a lot of people that are on sort of severe medications to deal with pain, etc., who need something for when the pain isn't as severe, who don't want to be dosed up, who want to still be able to function and manage their pain. So I thought, okay, what do I know that could help? And obviously any of you that know me know that I practice EFT, which is emotional freedom techniques, or tapping, some of you might have heard of it like that. And it can be used for all number of sort of ailments and conditions, from really sort of more minor things to, sort of severe depression, anxiety, panic attacks, fears, phobias, you name it really, it can be applied to great effect. But a lot of people don't know anything about it, so I just thought, well, if I sort of put this on the internet, people will come across it and hopefully be able to use it, to manage their pain, for this video anyway. Okay, so the process of EFT is quite simple, really, once you know what you're doing and where to tap. I will warn you that at first you'll probably feel ridiculous because it does look funny, and more than likely you will question why it works and how it works, which is fine, you can do that, and there will be other videos that will explain to you about meridian points and why it works and how it works, but that's not what this one's about. Okay, so to start off with, you need to tap the side of your hand. This is known as the karate chop point. And say what we class as a setup sequence. So it depends on your pain and what you're dealing with, really, as to what you put in here, but you start it off with "even though I have." Okay, so that might be this acute stabbing pain, this aching, this, whatever the pain is, however you describe it, whatever it means to you. So it could be anything, really. It depends. This toothache, this tooth, this throbbing, this, whatever words come to you as you're tapping. Now, I know that this feels strange, but just bear with me and you will feel the difference. Okay, so we'll start with this acute pain. Okay, so even though I have this acute pain, I'm okay. Now, with some people we will put in "I deeply and completely love and accept myself," but for some people at this stage it's just not possible to say, so you can put in that "I'm okay." Okay, so even though I have this acute pain, I deeply and completely love and accept myself. Okay, so even though I have this acute pain, I deeply and completely love and accept myself. Even though I have this acute pain, I deeply and completely love and accept myself. Okay, so that's your setup sequence. You can't over tap any point when you're tapping, and people often forget the sequence, but that's fine. As you can see, I'm still tapping while talking to you, so it doesn't matter. Okay, and then there's a point just above the eyebrow, so it's in the middle here. Sorry about that, my fringe is covering. Okay, and then so you just tap on this acute pain. Okay, you can, at any point, if the pain moves or shifts or changes in any way while you're tapping, I want you to focus on what the pain feels like. It might be an emotional feeling, it might be a physical feeling, and if it does, you still continue to tap but change what you're saying. So say I was tapping here and the acute pain changed from acute pain to like a hot sensation or a tingling, I would say "this tingling feeling." And then the side of the eye, "this tingling feeling." Under the eye, "this tingling feeling." this tingling feeling. And on the chin, this tingling feeling. And then in here on the chest, which would be about where you would tie a tie. You can do both sides and it still works the same. You don't have to tap on the left or the right. Either side works exactly the same because the points are mirrored. So some people tap both, okay? But you don't have to. That's completely up to you. Wherever you feel more comfortable. At the end of the day, we're trying to help, not make things more difficult. Okay, so there. And then under your arm, for the women, it would be where your bra strap would sit. So it's sort of about nipple height, about there for men. Okay. On average, you want to tap at least 5 times on each point. If you tap more or less, it really doesn't matter. But try and get to at least 5 if you can. Okay, so this acute pain. And then on the top of the head, do like a claw and tap on the top of your head. Okay, this acute pain. Okay, so that's a brief explanation of it. So what I'm going to do now is I'm going to run through a whole sequence. Okay, and it might help if you kind of grade your pain or whatever it is you're feeling. So if you consider the pain as it is before you tap, and what level it is, how intense it is, on a scale of 0 to 10, for example. So say, for example, right now your pain is a 9, and then you would then set up. So even though I have this really intense pain, I deeply and completely love and accept myself. Even though I have this really intense pain, I deeply and completely love and accept myself. Even though I have this really intense pain, I deeply and completely love and accept myself. This pain, my pain, my pain, my pain, my pain, this feeling, my pain, my pain, this feeling in my body, my pain, how it makes me feel, all this pain, my pain, how it makes me feel, all this pain, my pain. And then at the end of the sequence, it's really good to take a nice deep breath. So it's a real cleansing breath. Okay, and then what I want you to do is kind of reassess where the pain is. If at any point in the sequence the pain changes or moves, like I said earlier, tap on what you're feeling in that moment. Don't think, oh no, wait a minute, that's not what I was tapping on. It doesn't matter. If it changes, if it moves, if it shifts in any way that doesn't feel like it did at the beginning, tap on that. Use what you're experiencing right in that time, and that's where your EFT is so effective. It will really, really just change what you're feeling. Keep going with it. Obviously, if you have pain in any of the points where you tap, don't tap on that point. The last thing we want is for you to experience pain in the area you're tapping on. That's not what we're looking for. We're looking to ease the symptoms, not make them worse. Okay. So really today was just to introduce you to it a little bit. I will be putting more videos on hopefully soon, and this is the first one I've done, so I do apologise if it's a bit sketchy. These things take time, and it's a learning process for me. So yeah, but feel free to comment or contact me if you want any advice or guidance. Okay, and yeah, just use what I've just gone through, and hopefully it will really, really help. And make it specific to you. Pain is a very personal thing, so the more specific you can be, the better it will be for you. and it might actually mean that you bring up some emotional things. If at any point you become distressed during a tapping sequence, please, please, please do not stop tapping. Keep going with the sequence, following it round, doing the pattern. If you forget a step, don't worry, it doesn't matter. It really doesn't matter. Just keep tapping, even if it's just on here. You know, just keep tapping, just keep going with it. Keep going until it changes, until the pain dies down. If during the tapping sequence the pain becomes more intense, don't stop tapping. Keep going, keep going, keep going. And if it gets more intense, say about the pain getting more intense and the feeling of it and the sensation of it, and you'll notice that it shifts and it changes, and it might move to a different place altogether. And that's normal, that's very, very normal, but just keep tapping, okay? And make sure you drink plenty as well. EFT can make the mouth very dry, and can also cause you to need to drink more to sort of flush out what you're getting rid of. I know it sounds very strange, but the body is an amazing thing, and it will help, okay? So it's probably good to have a drink nearby if you've got one, or get one after you've watched the video and you've done a bit of tapping, okay? So thanks for watching, and for any of you that are experiencing pain, I really, really hope that this gives you just that tiny bit of relief, and just makes your day a little bit brighter. Okay, and hopefully I will be back soon and see you all again. Thanks, bye.